Senator Fawcett.
Thank you, Mr President. I rise to report to the Senate some concerns about the provision of healthcare in country South Australia. I had the privilege last week of spending 2 days in regional South Australia with Senator Fiona Nash, the Assistant Health Minister, who also has responsibility for, among other things, rural health, Indigenous health, palliative care, and also a role in the ICE task force. And we canvassed many of those issues with people in regional areas spanning from the southeast to the Riverland to the lower north. The prime purpose of our visit was to talk about training for junior doctors, particularly the provision of intern places in South Australia, where we currently have 5. We used to have 6. It's now gone down to 5. And according to the Rural Workforce Agency report of a couple of years ago, we need a minimum of about 20. And so we're looking to see how we can constructively work with the university sector, with the state government if they'll come on board, and with GPs in the rural communities to bring about such a program. But the topic I'd like to talk on tonight is palliative care services. One of the concerns raised with us in Mount Gambier is the fact that as of July 1, palliative nursing staff will be halved, bereavement services for Mount Gambier and Naracoorte will go, and a head of palliative care position will also be cut. Now, this comes at a time when in the media we're seeing reported that in Adelaide the state government is choosing to spend some $7 million to relocate palliative care services from Door House at the Repat Hospital to the Flinders Medical Centre, and will be building a 15-bed facility there. Now that's a separate issue, the closure of the Repat Hospital, and I'll perhaps discuss that on a separate occasion. And whilst I'm thrilled for people in the metropolitan area of Adelaide that there will be a brand new facility with 15 beds at the Flinders Medical Centre, I do question the relative priorities of the state Labor government, that they're spending $7 million to relocate an existing facility which, albeit is aged, but at the same time they are completely cutting services in one of South Australia's largest regional towns and the hinterland around that. There are a couple of reports that have come out just recently from people in the community who've highlighted the impact that these positive palliative care services have had. There's a story that came out on the ABC in June this year of a Mr Chris Couch, and he's talking there about the support that he and his brother Andrew received from the palliative care team at the Mount Gambier Hospital for their father, and highlighted the real difference that made to their ability to be able to care for their father in the community compared to the options that they may have faced if that support was not there. And so it is clearly an issue that the community is concerned about, and the thing I'd like to raise tonight is to highlight that this is an issue that the state government has in its remit to fix if it so chooses. The response to the media in Mount Gambier and the southeast from Country Health SA is to blame the end of the Commonwealth National Partnership Program. And I've gone back to look at that program to understand exactly what was provided, and a little bit of context. This was a program that was set up as a top-up, if you like, to try and overcome some of the inefficiencies in hospital services. It was set up under the former Labor government. I give them credit for spending that money. But looking at the program under Schedule E to the partnership agreement, South Australia received some $119.7 million between 2010-11 and 13-14. 4 additional subacute beds in the palliative care area falls under that, and rehabilitation services. What it also highlights, though, is if you go to page 8 in Table 1, which is Part 5 of financial arrangements, that the investment in these subacute beds finished in the financial year 13-14, even though the overall agreement stretched out to 16-17. And Mr Rann, who was then the Premier, signed up to this agreement. So the South Australian Health Department knew when they signed the agreement that this top-up funding was going to finish at the end of June 2014, or that would be the last time it would be funded. Under that agreement, the following years, there was no funding under the agreement. And so for them now to turn around and say that they are pulling these services in country areas of South Australia because this agreement has ended is just inaccurate, because if you look at the agreement, that funding stopped anyway under what they signed. It also is worth pointing out that under the coalition government, we have continued to fund and increase funding to South Australian hospitals, and in fact under the National Health Reform Agreement, under the activity-based funding arrangements, the Commonwealth will pay 45% of efficient growth in public health costs out to 2017-18. For South Australia, so this is just part of the health funding, and overall, as I've talked about in this place many times before, our funding to the hospital sector in South Australia increases year on year on year, but this particular part in 2014 was $1.124 billion, and by 2018 that's gone up to $1.3 billion, so a 16% increase across the forward estimates in the area that the South Australian government is making choices as to where it spends its money. If you couple that with the fact that there is some $1.8 billion of additional revenue that the South Australian government is receiving through GST that wasn't forecast at the time when we came to government, it says that they have no shortage of funds to spend to support the health services of people living in regional South Australia. And so this comes down purely to an issue of the priorities of the Weatherall government and Minister Snelling as to where they think it is worth spending money to provide health services for South Australian residents. And clearly, for people living in regional communities, they are not seen as a priority. Now, unfortunately for South Australians, most country areas are represented by Liberal Party members, and so it's very difficult for them to get political leverage to convince the state Labor government to spend this money in regional areas. So I would encourage anyone in South Australia listening to this debate who has family in the city, or indeed who lives in the city, to take this up as an issue of equity, because governments govern for all, regardless of who you vote for, regardless of whether you live in the city or country. Good government is here to govern for all and to make sure that there is an equitable distribution of available funds to provide services that are essential for people. And so in this area, where the Commonwealth still provides funding and increases funding, as I said, 16.3% increase over the forward estimates, the additional GST funding, this is a decision that the South Australian government can and should be making to support people living in regional South Australia. And bear in mind at the moment that much of South Australia's economy is dependent on the agricultural sector, and yet those communities who provide this income for the state also need the health services that gives them the confidence, gives young families the confidence to go and establish a career in regional areas, whether they be people working in the ag sector or the health sector or the many other parts of community that go up to have a functional and sustainable community. For our part, in terms of palliative care, the Australian government is funding some $52 million over 3 years to develop and deliver national palliative care projects that the palliative care groups have identified as critical to improving the quality and service delivery of palliative care. And in South Australia, Flinders University has got 3 such projects running. So this is an important topic, Mr President, for people in South Australia. For those in the city, can I urge you to take this up as a matter of equity? For those in the country, particularly in the southeast at the moment, who are affected, can I encourage you to not give up your fight, but continue to advocate and call for equity in funding from the state Labor government.
Thank you, Senator.